Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this is finding you well this week. I thought I'd cover a segment today about let's give the body what it needs. Let's copy nature, no more, no less, in balance and particularly hormones. So as you all know and follow me and visit me in the office, we do a functional, holistic, but really a personalized medical approach. So we're more advanced scientific evidence-based, but we're doing things personalized, particularly with hormones when we look at systematic effects and we look at hormonal balance. But let's do something and talk about something that patients often throughout the years will ask me now and then about, well, is this appropriate because people should go through menopause and hormones typically do decline and men do lose testosterone and et cetera, et cetera, et cetera. I have some answers to that, but I'd like to use a simple phrase as this. Let's give the body what it needs naturally, okay, no more, no less, in balance, optimal levels, okay, for prevention, because it's all about prevention, okay? If we look at studies, okay, we look at disease progression, we're seeing more and more advanced disease later in life. And that is not just anecdotal, that hormones also decline with age. Hormones are very protective to the body, okay? We're not talking about giving the body something it already has an excessive out of range. We're talking about giving the body what it needs. So whether that's estrogen, progesterone, testosterone, actually in diabetics, insulin, thyroid, cortisol, DHEA, I could go on and on and on, is these hormones, all of them are wonderful and very useful to balance the body, resolve symptoms, live optimally, but also to improve one's health and prevent degenerative conditions. I'd like to go over a case with you today because actually it was a lovely physician that I saw. She's on staff and at one of the local major hospitals here in southeastern Michigan. And she is been suffering after menopause with some vertiginous, or what we call vertigo, lightheaded, dizziness-like symptoms, and for years, decades, seen many specialists. She went through a slightly earlier menopause in her late 40s, and it seems like it correlates to at that time. Never got an answer, saw many institutions and many specialists, and even with some other hormonal-like symptoms, went to her OB gynecologist and discussed hormones and really was dismissed that, well, you're in menopause and your hot flashes aren't that bad, and you know, you could do some standardized estrogen replacement, but there's risks, and the doctor essentially left it at that. And she felt dismissed. That's her word. Well, unfortunately, about 5 years ago, it was discovered that she had an aneurysm in her brain, and she had an anomaly with arterial coiling and how the artery in her brain was, and she had to have some surgery, and it went very successful. And some of her symptoms resolved, but not all of her symptoms. And here in our approach, and she was referred by actually a patient of hers. Again, she's a physician here locally, and she came in to discuss, and it's only been our third visit, but after about 3.5, 4 months of our approach, she's doing lovely, doing wonderful. Can't believe how she feels. Cannot believe how the reduction of dizziness and lightheadedness, this vertiginous feeling is. And I'm optimistic, I told her, that if we keep her on hormones and keep her balanced and keep her optimal, there's a good chance that this decades of vertigo and lightheadedness will go away, because I have a theory, but it's also based on evidence. So what does in a female estrogen do? Estrogen is very neuroprotective, and particularly, to the myelin of the nervous system. We see this in MS, we see this in neuropathy conditions and neurodegenerative conditions. When women go through menopause and they lose estrogens, nerves, let's just say, become a little bit excitable and more heightened. And you can refer them to anything to angry, pain, numbness, but anything in the upper neck and head and brain and spinal cord, they could give you things like dizziness, lightheadedness, and balance issues and all that. Well, this lady, this physician, actually, I believe, suffered slightly from that. And we've seen this just like when we do this with MS patients that have gait and balance disturbances. But balancing someone's hormones, giving them what they need, giving them bioidentical estriol and estradiol in the right ratios, and doing testing to make sure that they're balanced, okay, and that they're not just symptomatically well, but they're in a preventative wellness model, often resolves a lot of symptoms and a lot of even degenerative things, just like this physician. So she's already, after about 3.5 months, doing wonderfully. I suspect that she's even going to get better over the next 6 months. We're also working on her adrenals, and she's getting some periodic, IV nutrition here for energy, and she's doing lovely with that. And she couldn't be happier. She was thinking about, actually, she told me today she was thinking about retirement a few years ago. She doesn't really want to retire. She likes what she does. She doesn't have to work excessively, and she's going to stay in her practice just because she feels great and has a new outlook on life. What could be better? What could be better, right? So what I wanted to cover with you is it's not one size fits all. Hormones can be lovely, protective, beneficial things. They have to be done personalized, okay? Estrogen is neuroprotective, okay? And it is about giving the body what it needs, no more and no less. Just getting in the right range and the optimal levels, okay? So I hope this enlightens you a bit and encourages you and gives you a little bit of hope if there's something going on with you hormonally. Never be dismissed hormonally. There is help out there. This physician actually said that she was going to have a conversation with her other doctors about the wonderful benefits of bioidentical hormone replacement, and done right, how she thinks that a lot of conditions, and she sees even in her practice, could be relieved and handled very well. So hope this encourages you and gives you hope. Share it with others. As you know, I'm Dr. Lewerenz, Longevity Health Institute. We're in Rochester, Michigan, southeastern Michigan, a few locations. Look us up on the web. You can call our office anytime or search for us, and we're happy to help. Our doors are always open. Again, Dr. Lewerenz, have a wonderful evening.